I would like to talk on the keyhole surgical procedures available for cure of diabetes. You will wonder why I am telling cure of diabetes. Yes, it is possible.
Environ Life Science Limited, partnering for life.
Hi, myself Dr. R. Padmakumar. I am a consultant laparoscopic surgeon at Keyhole Clinic Kochi and Lakeshore Hospital Kochi. I would like to talk on the keyhole surgical procedures available for cure of diabetes. You will wonder why I am telling cure of diabetes. Yes, it is possible. Diabetes usually is taken as a curse by many other people, thinking that it is something which is going to kill them, which is going to finish them off, their future is in dark. No, it's not true. There are ways by which you can really control diabetes. You don't have to take it its end of life. And what is possible? You know very well that you can try prevent diabetes by controlling your diet, your exercise, your lifestyle. Keep the blood sugars under control. People usually say sugar is there, sugar is not there. It's not like sugar is under control, not under control. That's all. So you need to keep the sugars under control. Normal limits of blood sugar is very much required, and you should try and keep those blood sugars within the normal limits. What diet you should follow? You should have something which has less glycemic index. Which of the diet which is going to increase the blood sugars very high, very rapid pace, you should try and avoid. Something like juices. People think juice is very healthy, but juice, what happens is you have large quantity of fruits or whatever with lot of sugar added. You may filter it off whatever is good in that is a fiber, and you just drink the juice and your blood sugars go up very much. Definitely you will have weight gain as well. If you see the scenario anywhere in the world, especially Indian population, South Indian population in particular, if you see the truncal obesity, that is obesity in the abdominal area, is very much, and 85% of the diabetic patients, diabetes is mainly because of this truncal obesity, the fat in the abdomen, seen as a sign of prosperity maybe previously, but it should be taken as a very bad thing to have, because you are not only going to have diabetes, you can have high blood pressure, you will have cholesterol high, you are at risk of sleep apnea, that is sleep related problems, sleep arrest itself in the night, that is something like your respiration. The intake of oxygen is very much reduced if you have snoring, which is very commonly known, and that is sleep arrest. You get various other illnesses. You can get a stroke, daytime sleep because of the sleep apnea, and cardiac episodes in too much of percentages, mainly because of this truncal obesity. So you should try whatever possible in your food intake, whether it is quantity of food or quality of food. Quality means it's not good quality. The bad quality food which you take, a lot of rice, lot of starchy things, lot of fatty food, that if you can avoid, maybe to some extent you will be able to control. Once it is lost, it is that control is lost, it is like a loss of control for vehicle without a brake, because then it is very difficult for you to have some kind of limiting factors. So it is something like a drug abuse or an alcohol intake. Once the person is addicted, very difficult to control. Similarly, it is a food or the weight if it is more than particular range. So one should try and keep normal range of weight so that many medical illnesses are controlled. Once it is you are out of control, you know that your weight is going up, your obesity is going up, you are getting diabetes, then you should resort to some kind of a procedure which can control these. For that, we have intragastric balloon. If when the medicines are not able to control, when the diet and exercise is not able to control your weight and diabetes, you have a device called as intragastric balloon. That is a a very pencil-shaped structure to be introduced via endoscope into the abdomen. Once it is in the abdomen, it will be inflated to 500-600 ml. So you will feel you have eaten something. It is like an undigested food in your tummy, so that you will eat less. Because of its presence in the tummy, the hormone secretion, ghrelin hormone, which is the appetite hormone, which will stimulate you to eat, that will come down. That is the same hormone which will keep the fat to the body. So cholesterol will be more for people who have lot of ghrelin. So once you can control the ghrelin with the presence of this intragastric balloon, your weight will come down. Once weight comes down, your diabetic level comes down, cholesterol comes down, your sleep apnea goes off, BP comes to control. So weight reduction is attained to a good extent. Maybe 15-20 kg maximum is possible with these kind of intragastric balloons, which are non-invasive, we say, because there is no surgery involved. You are doing it under endoscopic guidance, and after 8 to 10 months, maximum 1 year, you need to remove those balloons. So once balloon is removed, if you are not very careful, weight gain and other things are possible. So it may not have too much of a long lasting result, but it is still very desirable to bring down to a lower step so that you can continue in that level. So from bad to something good, it is possible. But if somebody has more than 30-40 kg of weight above the normal range, then your best choice will be to do keyhole surgeries. Keyhole surgeries for weight reduction and diabetic control, because it is called diabesity. Diabetes and obesity are so linked that it is called as diabesity, and the best solution will be to do a keyhole surgery. The commonest procedure is a sleeve gastrectomy. You are making a baby stomach, that's all. You can eat everything, you can drink everything which is sufficient for you to maintain your normal weight without any disease. You will get rid of diabetes the very next day of this keyhole surgery, which you will require for 3-4 days of hospitalization, but by the time you are discharged, you will be stopping your insulins, diabetic medications, all those. BP medications will be reduced, cholesterol medicines can be stopped. You can throw off your sleep apnea machine, which is very much used for controlling the snoring. So you will get rid of all these medical illnesses on a single day by this keyhole surgery, which is sleeve gastrectomy. If you have other medical problems like acidity too much, hiatus hernia, then we may do a procedure called as mini gastric bypass or a Roux gastric bypass. That is when these kind of procedures, the sleeve gastrectomy is not sufficient. That surgeon will discuss with you and decide. But mainly bariatric surgery in the form of a sleeve gastrectomy, making a baby stomach, it will be sufficient for you to reduce weight. You get rid of all the medical illnesses. And once diabetes is gone, it is so good that diabetic related problems, your eye problems, your cardiac problems, your kidney is saved, because you don't get into many of those problems because of diabetes. So diabetic related medical illnesses also comes down. For females, the PCOD, the polycystic ovarian disease, which is very much the cause for infertility, that also gets rectified. So once a person has obesity and diabetes, keyhole surgery will be the best solution to get rid of all these medical illness on a single day. It's very safe, very commonly practiced. Rest or anything, because after 3-4 days of hospitalization, you should be very active. If you are really exercising, moving around, following the diet which we give instructions, then it will be an excellent procedure, and it lasts for many years. If you are little careful, even 1/10 of care which you are trying to give earlier, you will be excellently gaining results in the form of all the medical problems, and diabetes also can be cured. If diabetes is not there for 5 years, it is called as a cure of diabetes, because even if you get diabetes at a later age, it will be taken as a new illness, and the complications also will develop only after 15 years from that second onset of diabetes. So you save your life, save your organs, and you can lead a very healthy and happy life. Thank you very much.